Okay, so thank you all for taking your valuable time to dedicate to catch up with EAHP. And if you have some topics that you would like to discuss further, just please let us know. So here's our famous investigation of the hospital pharmacy profession in Europe. So these are results from 2022-2023. Next slide, please. Before I begin, I would like to disclose, something. So I'm currently Vice President of the EAHP, and this investigation has not received any sponsorship. Keele University Center for Medicine's Optimization was commissioned to analyze the results. Board member that participated in this investigation did not receive any funding for the contribution to this report, and also I have not received the speaker's fee from the EAHP for this webinar. Next slide, please. I have three parts for the investigation. So how it began, where are we now, and where do we go from here? So let's start from the first, how it all began. So all began, next slide please, in 1995 when we launched first EAHP survey. Then every 5 years there were ongoing surveys from the EAHP. Then 2014 happened and we launched EAHP statements that we are celebrating today in 2024. So thank you, Gonzalo, for making introduction, so I do not have to waste time on this. And after this, from 2015 to 2018, the survey were focusing on statements, and they were published every 2 years, focusing on three different sections. And after that came COVID. And next slide, please. If we don't remember COVID, and this is the slide for the report. If you want to know more, you can visit the website. And also I have the link to the website at the last slide. So next slide, please. So we, as already Gonzalo mentioned, the survey focuses on our 6 sections on statements. So next slide, please. But we also have 3 parts. So we have section A with general questions about the participants' hospital pharmacy, such as workforce, skill mix, number of beds served. Then we have a section B, questions about the current activity of pharmacists around each statement. And section C, questions about the self-assessment tool and practice-specific questions. For the first time were introduced questions on pandemic preparedness as a learning from COVID-19 pandemic, falsified medicines directive, immunization, vaccines, and sustainability. Next slide, please. So where are we now? Next slide, please. So what is like in other continents? I managed to not to find any kind of survey of this kind in Australia and Taiwan during the last 5 years. Next slide, please. However, Canada has done a similar survey with response rate of 60%. However, they just have 240 hospitals. Next slide, please. In the US, so it's our the EAHP, so it's like similar to EAHP. In US, they have done a surveys focusing in 2019 on prescribing and transcribing, where the response rate was around 11%. And in 2020, the survey was focusing on dispensing and administration, and response rate was around 19%. Next slide, please. So how was like in our service in 1995? So in 2000 to 2005, we had a better response rate with 28, 27, 24% response rate. Next slide, please. However, when we started having a service focusing on statements, the response rate declined. So in 2015, 16, 18, we have around 15% response rate. Next slide, please. However, this year, or 2022-23, we have better response rate. It's 19%. It's not so good, but it's the same. It's similar to previous surveys with regard that are related to the statements. And this is just a short reminder. COVID came, that hit us really hard, so we had to deal with shortages, not just of medicines, but also of personal protective equipment. And also in focus came our extensive environmental waste due to this spending on personal protective equipment and contamination that contributed to the climate change. COVID also exacerbated antimicrobial resistance, that put antimicrobial resistance in the focus to European Commission, together with ischemic heart disease and stroke. And unfortunately, we also struggle with falsified medicines directive at the same year when COVID came. Next slide, please. So now I will present you the results. I will be short. So if you want to find out more, you can read the report, or you can, we are also expecting to publish the article in EAHP during the winter time in 2024. So you can also read that in the article, or you can send us an email. So regarding general questions, the findings indicated that hospital pharmacies that participated in the study have similar characteristics to previous surveys. So we can compare these two surveys that were in 2015 and 2018 done. Next slide, please. So for the first time, we introduced the question regarding a workforce development plan in action, as that was a real challenge after the COVID and during the COVID. And only Denmark, Estonia, Iceland, Lithuania, Montenegro, and Netherlands did not have a workforce development plan in action, while the others had. Next slide, please. Regarding the current activity of pharmacists around all the statements, so regarding section 1, introductory statements and governance, we had a really good response rate. But regarding the statement of the pharmacist in our hospital routinely work as a part of multidisciplinary team, this was only 52% positive, which was improvement from previous years, but from the 2015 it was a decline, which had percentage of 59%. So this is discouraging, but we have to work on it. And section 3, production and compounding, it had a really good response rate, ranging from 70 to 90%. Next slide, please. Regarding clinical pharmacy services, they, together with our statement to be clinical to hospital pharmacy work as a part of the multidisciplinary team, it also had lower levels of positivity with less than 60%. Next, please. So the 6 questions that were implementation of the statements in questions seems to provide the greatest challenges are following. So the pharmacists in our hospital enter all medicines used onto the patient's medical record on admission. Then the pharmacists in our hospital routinely publish hospital pharmacy practice research. The pharmacists in our hospital contribute to the transfer of information about medicines when patients move between and within healthcare settings. The pharmacists in our hospital work routinely as a part of a multidisciplinary team. The pharmacists in our hospital ensure patients and carers are offered information about their medicines in terms they can understand, and all prescriptions in our hospitals are reviewed and validated as soon as possible by a pharmacist. Next slide, please. All these statements are mostly indicated to the clinical pharmacy services, but the first statement that had around 30% of positivity was better than the previous survey. So this means that the change is happening, but it's going really slow. But we are optimistic here. Next slide, please. The main issues that were concerning these six statements were what is preventing hospital pharmacies from achieving these goals is limited capacity, not considered to be a priority by managers or other healthcare professionals do this. Next slide, please. Regarding the practice-specific questions, so this is the self-assessment tool in section C. Regarding have you created an action plan with the help of EAHP self-assessment tool? Unfortunately, most answered no. There were just few outliers, for instance, Turkey. So this means that COVID really hit us hard. So we need to do more things further, and so that's why we are having these webinars to explain you more on these self-assessment tools. Maybe next could be a webinar on this topic, so I will not go further into details. Next slide, please. Regarding on involvement or in the management of SARS-CoV-2 vaccines, we have a high percentage of storage and dispensing. Next slide, please. While we have less pharmacists' involvement in preparation of SARS-CoV-2 vaccines, with 12 countries with 10 or more respondents, or 50% of respondents were positives, like Austria, Belgium, Czech Republic, France, Germany, Hungary, Ireland, Italy, Portugal, Slovakia, Slovenia, and Sweden. Next slide, please. Unfortunately, we had little positive response relating to pharmacists' involvement in administration of vaccines and provision of document or clinical guidance. But regarding provision of document or clinical guidance, a 40 or more positive response rate came from Bosnia and Herzegovina, North Macedonia, Romania, and Turkey. Next slide, please. Regarding detection of falsified medicines directive, the question on since the implementation of the falsified medicines directive on 9th February 2019, were any falsified medicines detected in your hospital? Most countries reported no or not applicable. Next slide, please. While almost 70% of respondents responded yes, that it took more time for delivering medicines to the ward patient due to verification and decommission activities, longer time it takes to process and verify medicines, and more significant number of false positive alarms. So the only countries that reported that, hey, they have positive alarms were due to false positive alarms. Next slide, please. Regarding immunization systems, in most countries, most pharmacists do not have access to immunization information system to carefully screen patients' immunization history and provide appropriate counseling. In most countries, fewer than 20% of respondents returned positive responses, but Spain and the UK were outliers, reporting 40 to 50% of positive responses. Next slide, please. Regarding sustainability, respondents were either positive or unsure if they feel empowered to make or try any changes that could improve sustainability, which implies that this area is really limited awareness still ongoing. So it's a really good thing that we have a working group on sustainability. And I saw that Mina Elise here, she's really good co-chair in this group, and she's really doing a really good work in raising awareness, collecting the evidence, and sharing the best practices. So I hope for the next survey we will have a better yes response rate. Next slide, please. Regarding sustainability, next question. So the majority of respondents feel that there should be a greater focus on sustainability from organizational management perspective. So it means that their manager should put more focus on sustainability, while only 6% had the opposite opinion and 35% did not know, which is also a really high percent rate of unsure answers. Next question. So what we have conferred by this 2022-2023 EAHP investigation, that we are still dealing with limited capacity, although the COVID is behind us, that a lot of, for instance, clinical pharmacy services are not considered to be priority by managers, because a lot of things are other healthcare professionals' duties. So this is area that we should work on. Next slide, please. So where do we go from here? Next slide. There is a Canadian example, but for them it's much easier, as Canada has population of 40 million people. For instance, US has population of 300 million people, while Europe, so EAHP is not covering just European Union, we are much more, we are covering whole Europe. We have more than 500 million people that we have to cover in different countries. So for Canada, it's much easier to have better response rate, because they can focus much better on issues that are bothering them. For instance, the most powerful use of this data is when it is accessed to address particular practice or leadership questions. For instance, is our allocation of resources in the inpatient setting higher or lower with others? Are we allocating our inpatient pharmacist resources optimally, or we are looking at going 24/7? Is that a common approach? Next slide, please. So general recommendations is that further work is needed to support development of hospital pharmacists in clinically focused activities. Capability became one of the top 3 barriers to publishing pharmacy practice research and working as a multidisciplinary team. Therefore, sharing good practices initiatives and developing the EAHP website and Silk initiative to facilitate sharing of best practices should continue. So EAHP website will be renewed in 2024, so this will be much better. Next slide, please. To encourage awareness of the statements and participation in practice research, the educational content of the EAHP Congress, like posters and presentation, should continue to be linked to the relevant statements. And EAHP can provide a wide range of resources to help raise awareness about the importance of robust hospital and clinical pharmacy services in the hospital setting to deliver better outcomes for patients. And the use of self-assessment tool to measure progress with the statements implementation should be encouraged to increase their adoption. Next slide, please. And recommendations for the future, part 1, we should tailor the survey to the needs of specific countries or country. We also had the meetings with our delegates. Keep the survey as short and straightforward to complete as possible, for instance, similar to the shortage survey. Specifically inquire for each question if capacity and capability are the key barriers to implementation. 4th, construct survey response options for each questions to identify the obstacles other than capacity and capability. 5th, provide more in-depth questions for capacity and capability barriers. Example, no one is interested in hospital pharmacy. And 6th, identify the key drivers for change in countries where implementation has occurred or is occurred. For instance, like we have really immunization initiatives in UK and the Netherlands. Next slide, please. So part 2, so further work is needed to understand better the low response rate that we already conducted in the last 3 months. A named person like country coordinator will send an invite survey link. Weekly reminders should be sent out by the named person like country coordinator, and survey should be done in periods without major holidays such as Christmas or Easter, as this was the case with our investigation, which was going last year in December, and involvement of the board member in communication with the countries. Next slide, please. And instead of the conclusion, it's my statement about hospital pharmacies, because we are constantly facing challenges where traditional roles are still very important, but new roles as well. As the healthcare landscape continues to evolve, the insights gained from this investigation reflect the profession's commitment to delivering high-quality patient care. However, hospital pharmacy profession should gain more visibility in order to preserve and future develop medication expertise. Next slide, please. So if you want to know more, I put the link to our report, which is more detailed. And thank you very much. And if you have any questions, please, you can ask us now, or you can also write us an email. Thank you.
Thank you very much, Daria. And yes, just before giving the floor to you, participants, in case you have questions you want to address to us, just so you know, if you want to learn more about some of the activities, projects, initiatives, or even about the investigation, you can always send us an email to info@ehp.eu. And we're going to upload the webinar probably on YouTube, or we'll share the links on the website. But if you want the slides of the presentation, please also let us know, send us an email. And then in terms, I wanted to also take this opportunity to invite you all to the EAHP Congress that will happen from the 20th to the 22nd of March next year in Bordeaux. The main theme is around sustainable healthcare, and we have very, very interesting keynotes, sessions, synergy sessions also. And as I mentioned, also some like games and surprise linked with the European statements and their anniversary. And then again, also you have the beautiful city of Bordeaux that you cannot miss. So if you want to register, you still have time. You can go to our events section of the website and register. And if you have any questions about this, you can also always contact our events team. And we'll be very happy to meet you in person in Bordeaux. And then now, yes, as I mentioned, and I also pointed out, if you have any questions or you want to comment anything on what we just presented, you can take the floor now. So maybe because we're not that many, you don't need to raise your hand. Maybe just like, or raise your hand, Roshin. I'm seeing you raise your hand. Maybe you can unmute yourself and ask the questions. But then the floor is you. And as I see,
Sorry, I was just sticking my hand up. Apologies. Sorry, it's very dark here. It's kind of got darker around me. Apologize. Thank you, Daria and Gonzalo, for your presentations and also for all of that enormous amount of hard work. So it's really fantastic to be able to see all of that there and to see the differences with the countries. And obviously there are some things that we do need to think about, aren't there, really, that have changed or maybe haven't changed over the years from 2015 onwards. So really interested to see what we can do to help with that. I think probably one thing that kind of struck me was for example, the question around engagement with practice-based research, and that's something that we would see in the UK as well, is because clinical work has increased, then almost practice-based research has taken a sort of a back seat, and it's thinking about, and people would say they don't feel they're able to do it, or they don't feel they have the right skills. And so I think that's a big thing for us to make as easy as possible for people and try and set up partners, as well as where to start with, as you said, good practice initiatives for clinical practice. So I think there's a huge amount of sharing and learning that we can do there. So just excited to see how we can help. So thank you very much for your presentations. It's been very helpful. Thank you.
And thank you for your comment. It's very valuable. And unfortunately, due to the COVID, a lot of activities has stopped. So maybe that's why this rate of publishing the practice research has gone down, because everybody were just exhausted from the COVID. But I'm really optimistic, because there is a new motivation to move forward, because now we were actually on the front line, so everybody has finally noticed us. But we have to use this momentum and push forward and to be elaborative, and I think we should keep this pace and maybe to further to speed up a little bit.
I don't know if someone else from the participants would like to take the floor, because you have any questions or comments. And then again, if because you feel a bit shy, or just because you cannot think about something now, you can always send us an email to info@ehp.eu, and then we can back to you. Yeah, Havar, I see that you raise your hand.
Hi, thank you. I'm Havar from Norway. Just for the information to the participants, like if you're too shy to ask questions directly to Daria or Gonzalo, you're always welcome to contact someone in your national board or your national association's ambassador. So we are always like willing to answer questions from our members. So that's also an option.
Thank you very much, Havar. And that's true. You can find, if you have questions you want to address to EHP, you can always go through your national boards, and then you can also find the list of ambassadors on the statements website, and they can also probably answer to you already, or if not, they can address the questions to the EHP team. So I don't see any more hands being raised. So then, as we discussed at the beginning, the goal, we're going to be doing second webinar in February. In the first half, we will communicate the date at one point in January. And then again, we will, of course, also record the webinars, and we'll put them on our YouTube channel. And And then, yes, thank you very much for being here today. I know it's a bit late. Thank you very much for participating. And then not only for being here today, but for being interested about EHP, and probably some of you also for being part of the EHP surveys and for continuously working to help us out when we reach out and we will need to have volunteers for working groups, or when we need to have participants filling out surveys. So yeah, I think, unless you want to do any more closing remarks, Daria, or maybe if anyone.
No, I would just like to thank you all, because you are the part of EHP, and this is also the part that you are also contributing to, and without you we cannot do anything. So thank you very much for your contributions, and thank you for being a hospital pharmacist.
Thank you very much, everyone. And yes, as I mentioned, important thing is to stay tuned on social media, so you can know about the next webinars, and also about, as I mentioned, like the new things that we are working on, like for the anniversary of the statements and so on. So yeah, thank you very much. Have a very nice evening, and also Merry Christmas and happy holidays to everyone.
Happy holidays.
Thank you very much.
And
everyone.
bye.
Thanks very much.
Bye.
Bye. Merry Christmas.
Bye. Merry Christmas.